Good day, everyone. Of course, I'm John Corstein, Director Emeritus of the USS Monitor Center at the Mariner Museum and Park. And today I'm going to teach you all that history is relevant. The past enables us to understand the future and the present. I got to tell you, we about 102 years ago from this very moment, the world was gripped with what is known, today we call it the COVID-19 pandemic, but a similar plague 102 years ago would have been the Spanish flu. And the Spanish flu struck the world at a very time when they're caught up in the gas and gloom of trench warfare during World War I. And so added to the combat deaths and the struggles of civilians and so forth, you also had this need to produce materiel to support the war effort. And then all of a sudden, you had this highly infectious disease that spread everywhere. I have to say, 675,000 Americans died during the Spanish flu, and it killed between 20 and 50 million worldwide. We're really not positive how many because of accounting in Outer Mongolia and places like that. So actually, when you think about 675,000 Americans dying over a 2-year period, that adds up to be more people dying than have died in World War I, World War II, Korean War, and Vietnam. And so this is a shock. Today, I think the numbers are we're at 300,000 dead from COVID-19. And, it's a big problem for the world, and we're trying to solve those problems because we have science. In 1918, we did not have science like we do today, and we'll learn all about that. I have to tell you that this is one of my favorite things. I had a little bird, and his name was Enza. I opened up the window and in flew Enza. And you can see it was a little rhyme for jumping rope and everything like that. It is kind of harrowing. So where did the Spanish flu come from? Well, it did not originate in Spain, I have to tell you. It received the name because this gentleman, Alfonso the 13th of Spain, came down with the Spanish flu, of course. And since Spain was not involved in World War I, they did not have the censorship of information. So when he became sick, and all of a sudden everybody else is becoming sick, they call it the Spanish flu. And it's all thanks to Alfonso the 13th. But he had different names for the illness. We also called it the Hun plague here in America, also known as the German flu, as some believed the flu was a result of some diabolical and evil plot done by the Germans. Remember, to win the war. Remember, the Germans introduced what? Gas warfare and other hideous techniques. So it is, we as propaganda called it the Hun flu. If you lived in Poland after the war, because this flu is going to last from March of 1918 all the way until approximately February of 1920. So it was a 2-year plague, which was devastating. Poland, because they were worried about Russia trying to take them back over, invade them in the post-war era, called it the Bolshevik flu. So if you didn't like someone, that's what you called the flu. But we know there's a couple different stories. Some say there's minor outbreaks in January in Kansas, but we really can go to ground zero when we talk about an Army cook known as Albert Gitchell, who had been preparing chickens for the soldiers to eat, avian flu. Of course, he was at Camp Fuston at what is known Fort Riley, Kansas. And he reported sick on the morning of May 4th. And by midday, over 100 cases had been reported. There were so many sick soldiers within a week at Fort Riley that they had to request the use of a hangar to place all the injured people or sick people. And part of the problem is, if it breaks out in Kansas, this is a training camp for soldiers involved in getting ready to go over there. So these people from Kansas would go to like New York and Fort Devens near Boston, and of course down here to Newport News, because Newport News was headquarters of the Hampton Roads port of embarkation. So that's how it spread quickly into Europe. When our soldiers started to arrive in Bordeaux, they brought the disease with them. This is at Camp Funston, and you can see all the soldiers laid out. People aren't understanding the disease quite yet. So I think that's very, very important to see. There were several waves of this pandemic, and the first wave generally had symptoms of a 3-day fever, cough, and a runny nose, which was followed by a rapid convalescence. No one at the time recognized how dangerous this flu would be, and we had very few precautions that could be taken. Many doctors at that time were poorly trained, believe it or not. I could work with a doctor and say, I'm a doctor. We didn't have the medical schools like we do today, although there were several that were operating at the time, like MCV in Richmond. But once again, Louis Pasteur had identified germs, but there are a whole group of doctors says, well, we don't believe in germs. They don't exist. It's the bodily humors that go awry, and that's what makes you sick. So there were some that still bled people because the concept of the bodily humors, that was an Elizabethan concept about medicine. Way, way off, I have to say. So they couldn't identify how to treat the disease. And really, most of the work, as we see right here, is going to be done by nurses. And they had several suggested remedies, like they called patent medicine. The biggest thing, the U.S. Surgeon General recommended that you took 30 grams of aspirin a day. Now, this is like the chloroquine stuff that they said would work, but it didn't. The aspirin, recommended dose per day is 4 grams a day. So people were dying of aspirin poisoning as a result of this recommendation. Basically, not understanding the disease left everyone kind of flat-footed, so to speak. And yet they tried to cope with the illness as best they could. And like a miracle, between March and then in August, the symptoms, the flu seemed to have gone away. Well, I have to tell you, this is a scene that is very, very important to us today, because the second wave of the flu hit in September 1918. Here in Hampton Roads, the first case is September 13th, 1918. And basically, out of every 100 that will be infected, 800 would have severe flu symptoms and survive. Then another 200 would have severe lung complications, of which 120 would be considered desperately ill or dying. In fact, most of that 120 are those that did die. Regular flu symptoms came with this, but the big thing is that they were accompanied by an extremely high fever, 105 degrees, delirium, and muscle aches. This weakened the body's defenses and allowed the onset of pneumonia, which caused most of the deaths to set in. Victims would cough up pints of greenish sputum or a frothy, bloody substance. People basically drowned in their own fluids, which turned their oxygen depleted skin blue. And you knew you were dying because all of a sudden you get these blue splotches on your face. The second wave is going to be fought with more resolute action. I like this picture. Actually, down in overlooking Hampton Roads was this one embarkation camp called Camp Stewart. And so what they did, oh, the fever is so high. So what are we going to do to stop it? Well, we're going to put these guys, remember, this is December, November, and so forth. We're going to put these guys out in open air wards so that the cool air coming off of Hampton Roads would drop their fever. Well, that didn't work. So we tried to find all sorts of ways to try to stop it. Basically, the nurses really came up with the concepts of how this disease is spread, and it's spread by droplets, just like the flu or the COVID is today. And so the nurses came up with this way to try and fight it, and they had a 2-layer gauze mask. Now today we'd say that's not good enough, but at least they recognized how the disease was being spread. I mean, it was so bad that governments would step in and they would close hospitals, churches, dance halls, essential building businesses even were closed or open on only certain times. Gatherings, public gatherings were not allowed. Now remember, this is during World War I. And what's the best way we try to pay for the war? Is bond drives. So this does not work very well. Vital services were overstretched. The hospitals couldn't handle it. There were coal shortages, which exacerbated the circumstance because you couldn't heat your house, it was cold, and so that led to perhaps you catching what we call the Spanish flu. And the coal shortage was not because we weren't digging enough coal, it was that the transportation systems were overtaxed. If you're bringing troops to Newport News or bring sailors to Norfolk, those cars used to carry coal in many cases, and so there was this huge shortage, and that lack of heat in cold buildings allowed people to actually get sicker. The wartime needs of the military sometimes overruled safety. Soldiers and sailors seemed to always be in endless lines as they got ready to go on ships and so forth. You can see here's Red Cross working right here. We have our own Red Cross here in Hampton Roads on the peninsula. The office is right at Langley. And so there was one person, Marvin Wheeler, whose family owned a lumber company, which was making lots of money. So she donated herself and her Dodge ambulance, which she had bought with her own money, and helped support the Red Cross. But once again, look what they're mandating is masks to be worn. Now, in Europe, this wave struck, and then the second wave really hit the German army to the extent that it weakened their army at a time because they had poor diets. They're in rain-filled trenches, and of course, they too died like flies as a result of it. And we believe that the second wave of the Spanish flu was one way in which Germany found itself unable to continue the war effort, and therefore they sued for an armistice. The third wave was not quite as deadly. Many of the precautions that had been taken and implemented during the second wave helped lessen the amount of deaths. But this third wave lasted from December all the way through April, and it was horrific. I have to say, war-torn Europe was socially and economically weakened during the conflict. People died by thousands. The post-war revolutions only made the European death toll increase. Here you can see some nurses making masks. They used to make socks for the soldiers. More important that we make masks. I have mine here. So anyway, so by the end of World War I, Newport News had doubled its population. The city was simply unable to provide all the housing and services required to support shipyard workers, building construction crews. Remember, they were building all these camps. Langley Air Force Base, or Langley Field as it would be called back then. Fort Eustis was built, and then known as Camp Eustis, and several other camps like Camp Stewart, Camp Hill, Camp Alexander, Camp Morrison. This place was buzzing with people. You have to realize that Newport News, during this height of the pandemic, sent overseas 261,820 soldiers. And in August alone, 46,000 soldiers left Newport News. And we also saw 438 ships leaving Hampton Roads, taking war material, shells and other equipment and food over to the war. Now, it was seen that the port was obviously, this is one of the remedies, which we'll get to in just a moment. They thought onions helped protect you. So I think because you ate onions, you had bad breath. So that's what prompted the wearing of masks. Joke right there. Anyway, the port was busier than ever. The movement of people through the city increased, which allowed the pandemic to spread very quickly. Nothing seemed to really stop the virus. In October, more than 5,000 cases were reported in Newport News. Caskets of flu victims from Camp Stewart overlooking Hampton Roads were carried by trucks daily for shipment home. Flu patients at the camp were aired, as we talked about before, right there on the harbor, and that helped them die. One person, Solomon Travis, said the soldiers died like flies out there in the mud. So entire families were overcome by the flu. It was said if one family member came down with the flu, you put them in a separate room and you didn't interface with them as much as you could not. You had to bring them food and so forth, but because they knew how infectious everything was. U.S. Army farrier John J.L. Harlan, known as Joe by his friends and family, was stationed at Camp Hill. And being there at Camp Hill, you can see all the preventative that prevention is worth a pound of cure. And avoid crowds, get plenty of fresh air, keep the bowels moving. Believe it or not, that was a big thing. And so and you can just see the overcrowding on ships. No wonder these flu made its way to Europe from America because of scenes just like this. Harlan and the shipyard workers, you can see, they did not have any type of prevention, and yet they still needed to produce the ships needed for victory. I mean, it was all about winning the war, and then you had a pandemic. So this was pretty bad. Joe Hanshin, Harlan, excuse me. Let me get to him. There's his letter. And this is where he was, Camp Hill. So Harlan writes home, October 8th, 1918, the flu is in the height of its reach. He said that on account of the flu, all of the windows and doors are kept open day and night as a preventative from the flu. None of us have it yet. You see, we are outdoors and around stables so much that we are healthy. I ate an onion for supper tonight. The cooks gave them out as another preventative. So I ate an onion sandwich. We had company tonight. A man came up and gave us a little talk and told us some stories. He told us not to take any quinine, as the word came down from Washington that quinine was spreading the flu. It didn't. And for us to take plenty of psychic, which is medicines that purge, they're laxative, and so they wanted to keep those bowels moving to keep the disease out of you, and drink a lot of water. Um, the local governments would strike back at the flu, and this is a scene from Camp Hill. Now, let me come back to that in a second. Now, cities and communities would strike back. And look at this. This is during the flu, and look at all those people witnessing a, a ship launching. In fact, on July 4th, 1918, about 10,000 people witnessed 3 destroyers being launched on the same day at Newport News Shipbuilding, each one a death blow to the Prussians. However, it was also a death for many of the people who attended. So movie theaters were closed, dance halls, hostess houses, which was something that was set up. They were called canteens that were set up for the soldiers, away from home. Citizens were told not to crowd into streetcars. Limited access were provided to the courts. Churches were closed, and no visitors were allowed in hospitals. Newport News converted the newly completed Walter Reed High School into an emergency hospital, and a matching grant was received to combat the illness. Yet by November, this flu spike ended and was never again to strike, at least Newport News, with such vengeance. Norfolk was, also had its shipyards, also had Sewell's Point. They also had a major training base that you can see right here. This is actually where the Armed Forces Staff College is located today, over in Norfolk. They had the same problems because they had the facilities, they were building ships and manning the ships. This overcrowded made Norfolk a perfect place to spread germs and the accompanying sickness. There were some who took advantage of the pandemic to push forward their own political and social agendas. A Reverend Steinmetz of Norfolk was glad that the dance halls were closed, as he believed they were the source of immoral indulgences by servicemen that hurt Norfolk's ability to support the war effort. He said that dance halls and dances at the Army Hall were especially heinous, and that dancing enabled servicemen to meet prostitutes, etc., and spread a different type of disease. But the civilian and military leadership, oh no, once the spike ended, we're opening all those things because we have to deal with the people. Now, I have to tell you, during the spike of the pandemic, just in October, there were 9,000 flu cases reported in Norfolk, and 3,500 of them were recorded at the Norfolk Naval Station. But of all those, there was only 175 deaths. On October 22nd, Oregon's Rouge River Courier had received a letter from a woman that is working in Norfolk. Her name was Miss Bernice Umfelet, and she wrote to her sister, and she noted, "We are having a terrible siege of Spanish flu, or Spanish influenza, excuse me. Really, the people are dying by the hundred. They are using school buildings for hospitals, and all public places such as barbershops, schools, churches, shows are closed. The disease is very contagious. but I have not caught it thus far. There are so many dying that the undertaker can scarcely take care of the bodies. The condition is awful. It is like war. Wow. And so all of a sudden, the disease was gone by November, believe it or not. So mid-September, first cases of the flu were reported. There's no wonder why it would attack Eastern Virginia because of all the building and so forth, the building of camps. The war was reaching its zenith by September. Actually, the Germans were in retreat at that time. So in September, the community basically closed down. So you couldn't have the bond drives, you couldn't have the Red Cross workers passing out all the donuts. And then all of a sudden in November, the disease dropped. And so they started to do that. It is so strange that Hampton Roads did not have the Spanish flu like many other cities that were involved with the war effort. The best case example is going to be Philadelphia, which from September to December suffered 13,426 deaths. And many of them are connected to what was known as a super spreader event, which was a Liberty loan bond campaign, which 100,000 people attended. And 2 days later, 100 people a day were dying of the flu. We only realized about 600 deaths here in Hampton Roads. Once the spike ended in mid-November, the schools reopened. However, the students were tested for fever every day when they came to school. Life began to turn to normal. There's no normal during World War I because of all the troops and everything like that. You have to realize that as soon as that spike ended, we start to have, Newport News had victory parades when the armistice was proclaimed on November 11th, 1918. And they continued these through May, even though that third wave of the flu was hitting elsewhere, like Philadelphia from December to 1st of May. They lost almost 4,000 people. We did not. And it's an anomaly because they didn't understand science, right? So all we knew is we're going to wear a mask. And considering the amount of people that worked in war-related industries and the great number of soldiers and sailors passing through Norfolk and Newport News, these communities took the precautions when necessary. And because they knew, the only thing they did know, it was spread by droplets. That is the same issue that we have today. So that's why, notice this, no mask, no ride. Look at everyone wearing a mask. This guy can't get on. He goes, what? He doesn't have a mask on. And so that was people really, people used to run around spitting, which I don't know about that. But, they knew that coughing without covering your mouth, spitting, and so forth, sneezing, was what spread the disease. So I don't want to go to that yet. So anyway, that's why when COVID-19 broke out, immediately we thought of closing down many businesses because of how easily flus are spread. We also came up with the idea of keeping our hands clean. And we also came up with the concept of wearing masks. I can't speak as well with this mask on, but I think everyone should understand this is a safety precaution, not just for you, but those people around you. So anyway, so the Spanish flu mirrors COVID-19 in so many ways. We unfortunately did not have the science or scientific techniques that allowed us to study the disease more. And yet we know now since we also had the swine flu and other diseases that spread very easily, Zika and Ebola, that we have to take certain precautions, and we always have to be prepared for yet another pandemic beginning again. And so the lessons we learn now are the lessons that we'll share with those people in the future. Just like if you learned about the Spanish flu early on during this, you would have known some of the reasons why we took those precautions that were necessary. So anyway, that's the Spanish flu in Hampton Roads. And of course, that's not me in that picture. That's William Jeffers. He's almost as tubby as I am. But anyway, so if you have any questions about this lecture or any of my blog posts in the past, there's my email address. Just contact me and I will answer what I can. You know, I was limited to 30 minutes today, so there's a whole bunch of others really vibrant stories. So you can discover more by going to my blogs. One just got reposted by some people about the Roanoke. How come they did this ship? And so I had to answer back. These will be on YouTube. So if you weren't able to really see it all today, then you'll be able to just go and to youtube.com, the Mariners Museum. And also, of course, I've written 20 books. And so the one on the left is about World War I, where a lot of this information came from. And then, of course, I kind of like ironclads. And so I've written all sorts of books about ironclads, not just those two. So anyway, if you have any questions, hit me up.
We do, John.
Okay.
I'm going to start in the Q&A box, and then we're going to move over to chat because some people were having difficulty making chat work today. So Alan would like to know any theories on how that flu got to that cook at Camp Funston.
Yes. It's an avian-based flu. So remember at Wuhan, they said they were eating bats, right? And which they deny, and I haven't had one, so I wouldn't eat one. But he was chopping up chickens, to feed the soldiers. And so it came from those birds, more than likely. There was another case of flu in Kansas in January, but there wasn't a spread like what happened when Albert Gitchett, caught the flu, and then by lunchtime, 100 people came down with the flu. So they started to realize, how deadly or how bad it was just to be sickened by the flu. If you are a soldier, that takes you out of the routine. And so that weakens the war effort. That was the big, oh my gosh, what are we going to do about it? Remember several months ago, an entire U.S. Navy ship had COVID, or most of it. And so they had to isolate themselves. And so by isolating themselves, the pandemic on that ship went down. But you can just imagine all those soldiers going overseas in those crowded boats was just unbelievable. So it's an avian-based flu based on what he was doing and based on many of the other types of flus we've encountered. There are all these animal diseases we don't know about, and you can't look at a chicken and say, how you feeling today? I don't think they take a chicken's temperature or a bat's temperature, or I don't know. So anyway.
Thank you. John asked, what was the reaction to the restrictions on public worship? Did churches cooperate? Was it portrayed by some as a separation of church and state violation?
No, they did not look at it as a separation of church and state. They looked at it as patriotic. It was patriotic to wear a mask. It was patriotic to closed down non-essential places. So many of the churches just pressed the concept of individual prayer, and they were closed down for about 3 months here in Hampton Roads. So, but I didn't. There, of course, there's some people who are going to rail against censorship, going to rail against government involvement in their lives. But in this case, because of the war effort, you really had to follow the diktats of the government, local government, state government, and federal government. One of the odd things is, Camp Lee, right in Petersburg. Well, when the soldiers went on liberty, they'd go up to Richmond to have a grand time. And all of a sudden, the disease was spread. 16,000 people died in Virginia from Spanish flu. So all of a sudden, you have these people going from the camp where they're all crowded together having flu, and you may have the disease. You just are a spreader. So they go up to Richmond, and all of a sudden, Richmond's count of the flu increased to such an extent that they said, "Well, you can't come here anymore." And the soldier said, "Well, I guess not." And so they even, Virginia had passed a prohibition law in 1915. Okay, and no drinking in Virginia. You could still drink at the Chamberlain on Fort Monroe, but because that's federal property, but no drinking here in Virginia. So they said, well, alcohol is a way to stop the disease, and so they allowed the sale of alcoholic beverages. Only until that spike was over, then they said no more.
Well, tying into what you were saying about governmental rules, Kurt is asking the president not wanting to raise concerns at the time because of the war effort back in Spanish flu times. Can you comment on that about what the federal government?
Well, the federal government really did not. They did not respond to the pandemic as we have tried to. There was no CDC and other, governmental organizations that studied these pandemics. So you had a way to respond to them. We had a very mixed response here, but the government was more interested in what? Saving the world for democracy. So the health of individual people, they did not take the necessary steps to really solve this disease sooner, but they couldn't because of the war. Actually, Woodrow Wilson came down with the flu when he went to Paris, and he was very, very ill. And so when he went over there, he had all these lofty ideals, 14 points, oh my gosh, let people of one language all live together, blah, blah, blah. Well, when he recovers from the flu, he has been impacted by it because he becomes very harsh. Excuse me. It became very harsh towards the enemy powers and gave in to the German and the British, or the British and French desires to call for reparations and things like that, which made it difficult for Germany to create its own democracy, which led to Adolf Hitler. So, we believe Woodrow Wilson's having this disease is going to really change his mindset, and whether it's just an impact of the disease or not, we're not sure. But based on what he said in America before he went to France, it was a more egalitarian peace. Okay.
Michael is asking if you ever heard anything about people drawing a correlation between smoking and severity of the flu. Well, we know the soldiers aren't going to quit smoking for anything.
No, they were given tobacco. So, and no one made that connection. I think that they didn't have science. They didn't, lung cancer. What is that? They didn't. They didn't know how to even fight cancer back then. So, and one of my favorite stories is about a guy on the monitor who would go, he had a fistula in his nose, a separate hole, and he'd go and tell stories about being on the monitor. He wasn't there, but he told the story about he's there when Worden was wounded and he caught him as he fell out of the pilot house and he took care of him. This guy's smoking in the classroom. So he takes a draw off his cigarette and closes his nostrils and blows the smoke out of his fistula. Oh, I got that. That was from a splinter. And he was not on the monitor until October of 1918. So, but if you're in Sioux City, it doesn't really matter, you know.
Alan comments, it sounds like the flu spread from the U.S. to Europe versus the other way around. That's
yes,
true, right?
That's what they believe.
Yep.
Many flus seem to emanate from Asia. And is there a possibility it did come from there? We do not there, you know, we don't know if it did or could. Because there just weren't the records and that sort of stuff. And so the real first recorded is that army cook chopping off chickens, you know.
I was going to have chicken salad for lunch. I'm changing my mind. John asked, as is true today, Southwest Virginia was hard hit by the pandemic. Were the causes similar? Poverty, weak health system, etc.?
Yes, it would be. Although Southwest Virginia was not hit by this pandemic because they don't have troops going through. They don't, you know, and it's a lower population. Had the flu really reached them, it would have been pretty terrible. The only really war industry in the western part of the state is going to be coal mines, of course, and also Radford had a shell factory. They also had in Roanoke a prefab building company that actually built Penniman, the shell factory where the Yorktown Naval Weapons Station is today, and they produced 24,000 shells a day. So, and they all then got packed up, sent down to Newport News on the railroad, and over to Europe. So,
well, there was a story today about the impact of polio on Southwest Virginia. Later, obviously, but definitely similar in population and
right. And if you notice with polio, we had no clue what caused it, and so you had to find the cause, so then you could find the vaccine. And so by the 1950s, we had resolved those issues, and that's why the polio vaccine basically eradicated polio here in the United States, just like diphtheria and typhoid. Yeah, I all remember getting those shots, I'm sure. I'm glad when I think the second round I had to take of the polio stuff was in a sugar cube, which was so much better than getting that needle.
Yeah.
So, you know, yeah.
Marie shares that she had a great uncle served as a medical orderly at Camp Yaphank on Long Island, treating soldiers during the Spanish flu pandemic. Wow, I hope you were able to get good stories out of him. Heidi Walsh, Heidi, hello Heidi. Heidi's one.
Hey Heidi.
Yeah. How Hampton Roads with so many ports managed to avoid so many deaths compared to other areas. Military health care, military demands that their people follow advice or something else.
Well, it is just a quirk, in my opinion, because, you know, there's 70,000 deaths in New York. There's 12,000 deaths in Hoboken, which is where the port of embarkation was located. It's called the New York Port of Embarkation, but nevertheless, they had high outbreaks. So there is because we didn't have the science recording everything, there's no way to be able to tell what caused it. And so, that's very sad, but that's just what happens. And hi, Heidi. Heidi used to work with me a long
Yep,
time ago. Remember, she was working on that one book.
yep,
What is it? Big Bethel, I think.
yep, I remember.
So nice hearing from you, Heidi.
Linda comments that the cook getting sick at midday and all those hundreds of others coming down later that day doesn't seem like a long enough incubation time.
He reported sick in the morning. So in other words, during the night, he must have caught it the day before.
Uh,
Over the night, it became worse and worse. And so, he didn't report. And so the incubation time could be from the day before, which is more likely that he already had the germ and was spreading it and only felt deeply sick during the evening. And that's why he reported on sick call. So, and these guys, there were 100 cases by lunchtime, you know.
right.
So obviously, it probably came from the day before, because here's the cook serving up the food. Oh my gosh, let me sneeze at you. You know, uh, they didn't have a lot of sanitary practices back then, um, and so
Well,
is
I'm
the
sorry.
hygiene, sanitation issues. Um, and the lack of understanding the concept of the germ and how that germ spreads.
Mhm.
And it really catches on. That's why they went to wearing masks. And once again, as I said, it was considered your patriotic duty. If you didn't wear it in Philadelphia, you were caught spitting on the street, $5 fine. If you're caught not wearing a mask, $5 fine. That sounds like nothing today, but it was, a hefty cost back in 1918 through 1920. And the flu died out by 1920. They never had a vaccine. They couldn't understand the disease well enough to create one. We were very fortunate that from January, so basically, the flu appears about a year ago in China, and now we have on the cusp of having a vaccine for everybody. That's pretty impressive,
Yep.
in my opinion.
Well, we've got one last comment to diss on chicken some more. Delmarva has a lot of chicken farms, and there's been a high incidence, obviously, of COVID on
Right.
that area. Was the case back then any chance some of those chickens came to us from overseas?
There is no record for that. And five will get you 10, that wouldn't have happened.
Mhm.
They're in the mid zone of America, Kansas. And so people grew a lot of chickens, raised a lot of chickens. And so I don't think there's no person, there's all these studies that go back and look at the Spanish flu, which I don't understand the technology of medicine that I could grasp what they're trying to find. But nevertheless, they do not point their fingers at Asia in any way in this case.
And it was a 2-year flu.
Right. It came in 4 waves, actually.
Right.
The worst wave is the second and third. The second is worse here in the United States. The third is devastating in Europe. And when I say devastating in Europe, I'm not kidding. So it was pretty bad.
Well, Al comments or asks, do you see political similarities between Spanish flu and COVID-19 and foresee any long-term consequences? Like, please say it's not, we don't think it's going to last 2 years, but do you have any comment on that?
Well, I think because of the vaccine, it's estimated that uh, people won't be inoculated. Many people will not be inoculated until 2021.
Mm-hmm.
So that means, it's still going to be around. Will it be as virulent? My answer would be the more you vaccine, the more you take these people out of the equation of catching the disease. I mean, today, I think they passed 300,000 deaths in America. You know, Spanish flu gave us 673,000 deaths. So, you know, we're headed to a bad outcome in essence, and the vaccine can't get here fast enough. Now, people who say it's against my freedom to wear a mask and things like that, I'm not a politician, and but I will merely say it was proven during the Spanish flu that masks worked, and they still say it does today. So in World War I, it was considered patriotic to wear your mask. Um, so I wear my mask because I don't want to catch COVID, you know, period. And so that's why I stay at home writing all the time. So.
Well, I think we got all of our comments and questions. If not, definitely you may contact John at his email address, johnforstein@gmail.com. Next Friday, we will close out this banner year of 2020 at noon with John's program on the last days of USS Monitor. It's not a happy Christmas story, but it is a fascinating look at our favorite ship at the Mariners Museum, the Monitor.
That one of my favorite ships. I wrote a book about it. So
then,
yeah, next week is going to be joyful, and then all of a sudden it will be dreadful. So it's a really fascinating story. I'm almost finished writing my blog about it. This is my last blog and last lecture for 2020. I believe the Mariners Museum did so well in pivoting towards virtual programming. And so we're so happy to reach out to everyone with the stories that the Mariners Museum has and continues to share. So I'm glad I'm part of that. And so thank you for watching today.
And we'll say goodbye in a moment, but reminding our first one for virtual for 2021 will be on January 8th. One of our favorite admirals, John Worden of Monitor fame, John will be talking about the USS Montauk and Fort McAllister. So we look forward to having you with us again. We will see you next Friday, I hope. And let's say goodbye, John, with mask. And thank you all. Thank you for attending. We appreciate it. And thank you for your support. Bye-bye.
Thank you. Bye-bye.